This presentation is entitled Oral Obstacles to Optimal Health. The design in this presentation was to allow lay people to understand what the dental burdens in their mouth could be to their health. The following information is based solely on my personal opinion and intended for educational purposes. This is a picture of a soup bone. If I take a soup bone and I bury it in the ground, later I decide to dig it up, I won't see any marrow on the inside of that bone. I'll be able to see all the way through it. That's because in God's plan, there's certain bacteria placed on this earth to scavenge dead flesh. Here I have a model of the human jaw. It's in plastic, of course, but it shows you the arteries and veins and how they come in through the bottom of the tooth. The tooth that's in the center has been cut in half so that I could show you that the artery and vein goes all the way up through the center of the tooth. This is the part that a dentist can remove when he does a root canal. Where the tip of my black arrow is a portion of the nerve and blood supply that cannot be removed. It always stays in the jawbone. This is a drawing of a tooth. Notice in the center where the pulp chamber is. It's red and blue. That symbolizes the nerve and the blood supply going to the tooth. That's the portion of a tooth that a dentist can remove during a root canal. All the part that's yellow symbolizes the dental tubules. Those tubules are hollow and they contain bone marrow that cannot be removed during the process of a root canal. Now, one of the things that's a little confusing when you're looking at this drawing is that the nerve and blood supply give you the illusion that they go in straight lines. Later, you'll see how that's not necessarily always so. This is a microscopic view of the dental tubules that I was talking about. If this tooth were alive, all of those tubules would be filled with a marrow-like substance. This is the cross-section of those dental tubules. If you could somehow take each one of these millions of tubules in a front tooth and lay them end to end, they would stretch for 3 miles. Realize that these tubules are wide enough to accommodate up to 8 streptococci abreast. I'm going to try to give you a simple explanation about how a root canal is done. A file is introduced through the top of the tooth into the canals. The file is twisted and turned in an effort to try to entangle the nerve and the blood supply as it is torn free from the inside of the tooth. This is reaming out the main canals. The idea in the center picture is that we hope to gain as much freedom of those canals as possible so that we can clear them out in an effort to be able to push a putty, either gutta percha or biocalyx or any one of the newer materials, into the center of that tooth. The idea is you'd like to try to seal or caulk those tubules that we've been talking about. Now here's where the problem comes in. The inside of the tooth is still wet. You just tore flesh out and a nerve and blood supply out from the inside of the tooth. Now they do try to use some paper points to try to absorb as much moisture as possible, but there's still a small amount of moisture. Then this material that went in there slightly shrinks, which means that there's a gap between the tooth and the actual material that's in there. Let's envision your bathtub in your house. Let's say you're going to caulk the tub on a day that the tub is wet. Well, that won't work. You end up with a small amount of moisture underneath that sealant material, and bacteria can get underneath there and mold can grow. That's the problem with the inside of the tooth. Remember when I showed you the slide that showed the tip of the arrow going right to a blood vessel that's at the tip of the tooth? You see, when you have dead flesh, that bacteria does not require a blood supply in order to move. We get back to our soup bone that we buried in the ground, and there was no blood supply in the ground carrying that bacteria. The bacteria is free to move, but it requires a blood supply for a white blood cell to move. So the white blood cell can only get as far as the tip of the tooth. It can't get inside. Yet that bacteria, which is anaerobic, can crawl right inside that tooth in order to try to scavenge the dead flesh that's inside the tubules. That bacteria is anaerobic. It lives without oxygen and requires a few things: a dark, moist, warm environment. Therefore, we have heaven inside this tooth. As that bacteria multiplies, It can either move back outside of the tooth and destroy some of the supporting bone around the tooth, or it can get back into the bloodstream and circulate throughout the body. Now, your primary care physician may pick this up in your blood work. If he sees that your neutrophils are slightly elevated and the lymphocytes are slightly depressed, then that means that you could have a chronic low-grade infection, or your white blood cells may be too high or too low. That seems to be the main problem with the caulking material. Here's another representation of a dentist doing a root canal. You'll notice that the file is in one of the main canals, but you'll also notice some lines coming off to the side. Those are called accessory canals, and they still maintain some blood and nerve tissue inside. There's not a way to clean those out. Here is an illustration of the gutta percha being placed inside the tooth after it's been root canaled. You'll notice that the gutta percha material cannot go into the accessory canals. Occasionally the patient will still have pain and have to be referred to an endodontist. Here we're looking at the anatomy of the canals. The earlier pictures that I showed you gave you the illusion that there were only 2 canals in these molar teeth with 2 roots. Sometimes there can be 3, 4, or 5 canals in a single tooth. Here you will notice that sometimes the canals branch off, making it virtually impossible for the dentist to remove all of the dead flesh inside. Here I have an x-ray on the left of 2 teeth that have apparently abscessed. On the right, those 2 teeth have been treated with root canal therapy. You will notice that the bone around them is still dark. It's assumed that doing the root canal treatment will totally take care of all of the infection in the bone. Realize that there are over 150 different bacterial strains that have been identified at the tip or apex or within the pulp chamber of dead or dying teeth. Since gutta percha doesn't show up on the x-rays, heavy metals including mercury and lead are sometimes added to make it radio-opaque or appear white on the x-ray, sometimes up to 20% of its content. Other chemicals it can contain are formicreosol or parachlorophenol. These substances can cause inflammation and infection, as well as allergic reactions, and compromise the immune system. Here's yet another problem with the material that's used to caulk the inside of the tooth. The material has to be warmed so that it's slightly malleable, so it can be pushed down into the canal of the tooth. Sometimes the material gets pushed too hard, or the apex has a hole that's too large, and the material goes beyond the confines of the tip of the root into the bone supporting the tooth. So why can't you just simply take an antibiotic if the tooth reabscesses? Well, remember the dentist took out the blood and the nerve supply that goes to the inside of the tooth. We only have a nerve and a blood supply that go to the tip of the tooth. When you take an antibiotic, it requires the blood in order to circulate and get throughout the body. So that means that that antibiotic can really only get to the tip of the tooth. It can't get inside the tooth where all of our bacteria is feeding off of the materials that are inside those small tubules. Here we see an image of digital imaging or thermography. We have some suspicious areas that may be dental infections. Remember, the bacteria inside a root canal tooth can travel to another area of your body. And remember that 75% of root canal teeth have residual bacterial infections in the dentinal tubules. Most dentists would look at this x-ray and try to explain to a patient that this is an x-ray of a perfectly healthy root canal. That's an oxymoron. You can't have a perfectly healthy, dead something. That's like me taking you to a funeral home and asking you to vote on which of the 10 dead corpses that are laying there is the healthiest. What we can agree on is that it is a technically well done root canal. It doesn't appear that the material has gone beyond the tip or the apex of the tooth. Some dentists will claim that they can do something called a